Centre Hospitalier Adventist d'Ophtalmologie, Glei Adventist Eye Hospital. Is located in the village of Glei, in the Atkapame region, 138 kilometers north of Lomé, Togo, on the main north-south road. The 9 acres property was deeded in the year 1979 to the Seventh-day Adventist Mission. An additional 4.5 acres was added in 2003, making a total of 13.5 acres. The institution officially opened in March 1984 as a general medical facility called Glei Health Center. The center was built by the efforts of the Northern European Division of SDA on the Accra-based West African Union. Elder Odd Jordal, Director of Development Aid for the Union, directed the project. Yves of West Germany helped sponsor the project. Dr. Felipe Valente from Portugal served the hospital as its first medical director. Unfortunately, Glei Health Center was closed in December 1988 because of low patient count. It reopened in October 1992 as an eye hospital to provide ophthalmic clinic, surgery, and emergency services. To date, CHAO has continued as an ophthalmic center. Infrastructures. There are 3 good-sized consulting rooms with waiting areas outside. A smallish operating theater has an anteroom used for sterilization and a separate room for administering eye anesthesia. Separate rooms are used for sale of glasses, frames, pharmacy, and cashier. 4 wards accommodate 18 patients. There is good space for administrative purposes. The hospital has a good ophthalmic equipment, though most of these are decayed. Mission. As a Seventh-day Adventist health institution, the foremost mission of CHAO is to share the everlasting gospel of Jesus. Specifically, this hospital has chosen to follow Jesus' example of ministering to the blind. To accomplish this, CHAO seeks to relieve and/or prevent vision-threatening conditions through surgical and medical care, and to address other eye problems as able, while not forgetting the health of the whole person. Patient visits from 1992 to 2009. The number of new patients we have each year is more than 2,000 and increases with years. The cases commonly diagnosed here are cataracts, glaucomas, mostly open-angle glaucoma, refractive errors, pterygia, uveitis, trachoma, childhood blindness, retinopathies, mostly diabetic and hypertensive, corneal ulcers and various keratitis, conjunctivitis, infective, allergic, etc., vein and artery occlusions, retinal detachments, as everywhere in the world. The leading causes of blindness is cataract. Surgeries 1992-2009. As far as this year is concerned, from its beginning to date we have done 236 surgeries, more than a half of which have been sponsored by donations, just like in the past. Of the so many inpatients diagnosed with surgical-related treatments, only some will finally undergo operation due to our limited funds for subvention. Since our hospital opened, several rich and powerful eye services have become available to third world countries, including Togo. CBM and ADRA have been of inestimable help to this institution for years. Thanks to the relentless efforts of the above-mentioned partners, thousands of poor people have been able to regain their sight through sponsored surgeries. We highly appreciate the help of CBM and ADRA to CHAO in many other ways too, though it is not enough to cover the large number of other needy people who go blind because they lack the means to take care of their eye problems. Not to mention the huge needs of CHAO itself in terms of infrastructure. In the past we have been blessed with donations for subventing poor patients from other sources than the above-mentioned partners. These include individuals. These have been salutary to the patients but still not enough. They are so grateful and full of joy when the pads are taken off their eyes. It should be noted that during our outreach programs, there are hundreds of patients diagnosed with cataract and other eye ailments needing surgery, but only a few are able to come to the hospital for treatment. The above chart is just an example among many others. If all the cataract cases diagnosed both in CHO and outside could be operated, we would be able to perform more than 500 cataract surgeries a year and thus kick out preventable blindness, at least to a certain degree. Cataract have been leading cause of blindness worldwide and more so in Africa. Unfortunately, the limiting factor is, once again, extreme poverty. Togo being one of the poorest countries in the world. Most of the populations we attend live in rural areas where they earn their living as little farmers with large families. The people we meet during our outreach really breathe poverty. Gospel outreach. There were no chaplains until 2003, when the union leaders arranged for a global missionary to come for that year. In 2004, we had a part-time chaplain, the head elder of the local church, who was paid by outside donations. In 2005, we had both the half-time chaplain and a chaplain outreach worker, sponsored by Gospel Outreach. CHAO has never yet included a chaplain's salary in its regular budget. Currently, we have just the chaplain of Gospel Outreach. The chaplain has worship with surgery patients in the wards and also with the outpatients before the opening of each clinic session. He also invites and encourages the patients to attend our church services. He has been working to develop new church companies in the area. We have tried to provide a Christian atmosphere by keeping the hospital clean and well maintained, by decorating the hospital with Christ-centered pictures, and by using Christian videos in the lobby. The staff begins each work day with worship. Together they have read several of the Conflict of the Age books. It appears that some of the staff members have grown spiritually over the past few years. Our hospital attracts patients from people groups that can be difficult to reach with the gospel: Muslims, Fulani, remote villagers, and people in high position. Medical excellence. Many patients come to CHO Glei because they receive a careful diagnosis and excellent medical care. These include government workers and patients from other countries. We take satisfaction in our surgery results, much of which can be credited to careful follow-up. Sometimes patients come in that have been cared for by charity groups that perform many surgeries in a short time, and we have observed that many suffer from a lack of follow-up. Excellence, we feel, is something we can offer our patients. Our surgery patients usually stay at most 5 days. This not only gives us time for good follow-ups, but also allows us to minister to their souls. We have tried to be diligent in training our staff in medical care. Most of our staff has not had an opportunity to receive formal medical training before coming to CHO, but we find that we have become quite skilled and they seem willing to learn more. Summary. We at CHAO have seen the eyes of the blind opened. We have heard the lips of our patients praise our wonderful God. Our hospital has touched the lives of thousands of people who otherwise would never have met the Seventh-day Adventists. The high and low, rich and poor. We have seen our staff grow spiritually and professionally. However, the challenges are still huge. There are thousands of poor people who can be saved from going blind, but they have not been reached yet due to economic constraints. The hospital needs to be renovated in so many areas too. We believe our Lord will provide according to His riches in glory.